Health insurance open enrollment's coming up this fall for millions of Americans. Whether you get your health insurance through work, on the exchange marketplace, or are eligible for Medicare, here today with some tips on how to pick a health plan is Clipp, Executive Director with UnitedHealthcare of Ohio. Thanks for joining us today. So we want to jump right in here. What is open enrollment?
So open enrollment is the one time every year that you have an opportunity to update or change or, make amendments to your health insurance coverage. That could mean changing the people you cover in your family, or again, changing the benefits you enroll in with either your employer or through Medicare.
And when can people purchase health insurance?
So the timing of open enrollment can vary a little bit. So let's make sure everybody understands what questions to ask. If you are covered, like 180 million of us are, on an employer-sponsored plan, then there's usually a 2 to 3 week period this fall that your open enrollment would happen, where you can make those updates and you can elect what coverage you'd like going forward. If you're more of the 64 million of us that are covered on Medicare, there's a period of time that open enrollment lasts for during the fall from October 15th to December 7th, and that would be when you'd make your elections.
And what are some tips that can help people pick the right plan or even save money on their health care?
There's a lot of great tips out there. So the first and most important is don't let this time pass you by. Always look at your open enrollment options and really think about what deductibles you might have available, what co-pays and co-insurance, some of the things that we all take for granted each year. We just want to make sure that we understand what changes might be coming so we can make the best choice. Once you've done that, one of the first things many of us use is our prescription drug benefit, our pharmacy benefit. And so really taking a look at that, if there's any changes to it, if you're on certain medications, maybe looking into mail order can save quite a bit of money, as well as some of the other programs available, coupons and some of the step therapy that might be available for different drugs. So really check out those prescription plans as well. Another important area that hit a lot of us, and is something to check out as you're thinking about open enrollment, is mental health. And that really during COVID especially was brought to the forefront. And what we've seen a lot is that stigma changing from having to go and sit in someone's office. The old idea of sitting on someone's couch and talking about things has changed. And now there's a lot of virtual mental health options available for people as well. And so it can really fit in your schedule however you might need it. So be sure to check those resources out as well.
Where can people go for health insurance information?
So there's always questions, and we have a lot of resources out there for you. So make sure, again, as you're exploring what your options are, there's a great website that has a lot of tools and videos. It's called UHC-OpenEnrollment.com. And again, can answer questions from what is a deductible to how to search for care or coverage and understand your benefits better. As well as if you're on that Medicare plan that we talked about previously, MedicareEducation.com is a very good website that has a lot of the information that you might need and can answer a lot of those questions. So make sure you do your homework and check that out before you get to open enrollment so that you can pick the best plan for you and your family for the year ahead.
Well, Caitlin, thank you for sharing this information with us today.
Thanks so much. Have a great one.